Hi, everyone. If you're watching this video, it probably means that you aren't able to make it to our Zoom sessions, which is totally okay. We think our topic is very important and we want to make sure that it's accessible to anybody as much as possible, which is why we're recording this video for you to watch whenever and wherever you want. So thank you so much for taking the time out of your day to watch our presentation. So without further ado, we'll go ahead and begin.
Hi, everybody. We're the FPL Coachella Valley Group #1, and our presentation is on diabetic retinopathy and how we can prevent it. Next slide, please.
Meet the team. I'm Alexa Villeda-Soto, and I'm an incoming transfer biology student at UCR. Next is our teammate, Ashley Wilikins.
Hi, everyone. My name is Cindy Nguyen, and I am a 4th year at UCR.
Hi, everyone. My name is Danica Vendriza, or Nika, and I am a recent graduate of Pomona College.
Hello, everyone. I am Dulce Ortiz, and I am a first-year college student at COD.
Hello, everyone. My name is Saida Ortiz, and I'm a 2nd year at Barstow Community College.
Hi, everyone. I'm William Wong, and I'm going to be a 3rd year at UCR. Next slide, please. So who are we? We are a part of the Future Physician Leaders Program, which is actually a pipeline program from UCR School of Medicine. Our program is an 8-week summer program which aims to educate the community about a certain healthcare topic and bring awareness to the community about said topic. Next slide, please. So, our mission this summer is to educate and spread awareness within the Inland Empire and Coachella Valley regarding diabetic retinopathy, specifically what exactly it is, some of the symptoms associated with it, how to prevent it with a healthy lifestyle and healthy diet, and if you are affected, how you can improve your own health. Next slide, please.
Disclaimer note, just to clarify, we are not highly trained medical professionals. Therefore, the information presented is not meant to substitute any form of medical professional help or diagnosis pertaining to you or anyone else. Next slide, please.
All right, so before we go ahead and start presenting new information, we would really appreciate it if you could take this pre-survey that we have here loaded. We'll go ahead, you can go ahead and pause this video. Usually we would give folks around 5 minutes to complete it. We do want to emphasize that while it is voluntary and all of the information will remain anonymous and will be permanently deleted by August 13, 2021. We would really appreciate it if you could take this survey because it will help us determine if our presentation was effective in educating you and other viewers about diabetic retinopathy. So once you've gone ahead and taken the survey, you can go ahead and unpause. And without further ado, we'll go ahead and begin. Next slide, please.
Okay, so let's start. You guys may be wondering, what is diabetic retinopathy? So diabetic retinopathy is a diabetes complication that affects the back of the eye where light-sensitive tissues are located. The blood vessels located in that area begin to swell and begin to leak. This condition is the most common leading cause for blindness in America. So in the two images depicted below, the image on the left is an image of a healthy eye, while the image on the right is an image of an eye diagnosed with diabetic retinopathy. Like previously stated, blood vessels begin to swell in the back of the eye as indicated in the zoom in portion of the image. This causes vision loss due to insufficient transfer of oxygen, which is very important for tissue function. And yeah, so this is what causes blindness, is the leading cause of blindness in America.
So there are two types of diabetic retinopathy. The most common among the two is non-proliferative, which is where the tiny blood vessels leak blood or fluid, causing them to form deposits. The second one is the more severe one, which is the proliferative one. This one is where abnormal blood vessels begin growing, which cause scarring and retinal detachment. Next slide, please.
So what are the symptoms of diabetic retinopathy? So the four major symptoms associated with diabetic retinopathy is blurry visions, floaters, blind spots, and the ultimate symptom of the very last stage is total vision loss. Usually in the non-proliferative stage, which previously mentioned by Alexa, is the less severe stages of eye damage. Blurry visions and floaters are common symptoms, while blind spots and vision loss are usually more severe symptoms that occur during the proliferative stage. We want to emphasize that if you ever witness any of these four symptoms, it's so important to contact your physician because early detection is key in prevention. Next slide.
We hope you're ready for a pop quiz. It should be really easy. You guys got this. Next slide, please. Okay, so what is the last and worst stage of diabetic retinopathy? We have A, see new colors, B, total blindness, or C, lose an eye. Okay, you guys can go ahead and pause and try to answer that on your own. Next slide, please. And hopefully you got B, total blindness. Next slide.
All right. So to recap, we just went over what diabetic retinopathy is, the two main types of diabetic retinopathy, and the symptoms of diabetic retinopathy. So now we're going to be going ahead and taking some time to talk about who is affected and who is at risk. So as stated previously, diabetic retinopathy is a diabetes complication. This means that as soon as someone is diagnosed with diabetes, they are automatically at risk of getting diabetic retinopathy sometime throughout their lives. However, this doesn't mean that they'll automatically get it. Through prevention tips that we're going to be sharing in a few slides, we'll find out that it is preventable and something we can avoid. But before we get into what makes someone even more likely to get affected, let's take a look at some statistics. Next slide, please. So this particular statistic is from 2004, which we know is fairly outdated. Unfortunately, there isn't as much data about diabetic retinopathy and how it affects certain populations as we would like to see, but that's another matter and another conversation. So as of 2004, 1 out of 29 people ages 40 and up have been diagnosed with diabetic retinopathy. Next slide, please. Here we have a more recent statistic. In 2010, according to the National Eye Institute and the National Institutes of Health, 7.6 million people in the United States had diabetic retinopathy. And if you take a look at the graph on the right, you'll see that that number is only expected to increase. So in this graph, I'd like you to pay attention to the orange bar specifically, which is representative of the whole population. So in 2010, that number is 7.6 million. By 2050, in 40 years, that number is expected to double to 14 million. This is really alarming, especially because diabetic retinopathy is something that we can prevent. And we're going to be talking about that in the next slides. Next slide, please. So as we've been mentioning, and we'll continue to mention throughout this presentation, just because a person has diabetes, it doesn't mean that they will automatically get diabetic retinopathy. This is why it's really important to be aware of the risk factors that will make someone more likely to get diabetic retinopathy, because education is the first step towards prevention. So if you take a look at this slide here, you'll notice that a lot of the risk factors that will increase someone's likelihood of getting diagnosed with diabetic retinopathy has to do with how well they manage their diabetes. It's really important to make sure that your blood sugars remain at stable and relatively low levels, and that you watch out for high blood pressure and high cholesterol levels. If any of these get out of hand, the chances that you will get diagnosed with diabetic retinopathy will increase. If you are smoking, that also plays a big role, and chronic smokers are more likely to get diagnosed with diabetic retinopathy. How long you've had diabetes also plays a role, and the longer you've had it, the more likely you are to get diabetic retinopathy. And finally, if you are pregnant and become diabetic during your pregnancy, or already have diabetes and become pregnant, that the chances of getting diabetic retinopathy increase greatly as somebody with gestational diabetes. Next slide, please.
So let's talk about diabetes and eye health in the Coachella Valley. So here are some statistics. 10.1% of California residents have been diagnosed with diabetes, compared to 12.2% of Coachella Valley residents who have been diagnosed with diabetes. As we can see, there is a massive gap in the numbers here, which is attributed to a health disparity. This is caused by several barriers, which I'll elaborate in the later slides. For example, one of the barriers would be that 43.6% of adults with diabetes have never taken a course or a class on how to manage diabetes on their own. This is one of the reasons why Coachella Valley residents have such a higher case of diabetes than California on average. Next slide, please. So now let's talk about San Bernardino County. 10.8% of adults in San Bernardino County have been diagnosed with diabetes. This percentage is still higher than the California average of 10.1% and is also still caused by barriers people have to healthcare. One of the biggest problems is that about 32 out of 100,000 people have died from diabetes complications, which is actually 50% higher than the state average. Next slide, please. And now we can talk about some of the barriers that actually cause this discrepancy. The lack of education is a major barrier. Like I said previously, 43.6% of adults in the Coachella Valley have never taken a course on how to manage their diabetes. As a result, their diabetes goes out of control, leading to complications such as diabetic retinopathy. Another barrier is the lack of insurance or the lack of finances. Without insurance, visits to the doctor become incredibly expensive. And because of that, people simply don't get diagnosed with diabetes. If they don't know they have diabetes, they can't manage their diet and their lifestyle well, leading to complications like diabetic retinopathy. And finally, the lack of support systems. There aren't enough food drives and food pantries in our area, which can provide fresh, healthy groceries to people. And as a result, people have to turn to the frozen food or the fast food alternative. This also causes the massive discrepancy we see between the Coachella Valley, the San Bernardino Valley, and the California average. Next slide, please.
So now we are going to discuss how to actually prevent diabetic retinopathy. Next slide, please. In regards to prevention, something you can do is adopt a healthy lifestyle, meaning you're going to make healthy diet choices that are balanced and consistent, and you're going to try and avoid eating fast food or any other bad habit. Now, it's okay if you have a cookie once in a while, just as long as it's not constant. And you should also exercise. The max is 30 minutes. You could always adjust it to your schedule, and you should stay hydrated while exercising. Some of the major habits you definitely should avoid are smoking, drug abuse, and alcohol abuse. Next slide.
Some more prevention tips that you can do is have regular eye exams every year. The earlier this is detected, the less damaging it is to the eye. It's also important to keep your blood sugar, blood pressure, and cholesterol levels under control. Next slide, please.
We hope you're ready for another pop quiz. It's very exciting, I know. Next slide, please. Okay, so which one of these is a healthy food option? A, cheeseburger with large fries, B, family size bag of chips, or C, pesto chicken with rice and broccoli? Okay, and again, you can go ahead and pause to answer this on your own. Next slide, please. And hopefully you got C, pesto chicken with rice and broccoli, although the other two options do sound yummy. Next slide, please.
All right, so in this slide, we would like to share some local resources that we were able to research and find more about through our research. These are specific to the Coachella Valley and Riverside County. So yeah, so first we have the Riverside Chronic Disease Collaborative. Second, we have the Eisenhower Health Diabetes Program. And third, we have the Riverside Free Clinic Diabetes Management Program. All of these resources and a few more are also listed on our website. So make sure to go check that out, and we'll be providing the links later. Next slide, please. So I'm sure you guys are tired of hearing this by now, but we're going to keep emphasizing that just because somebody has diabetes, it doesn't automatically mean that they will automatically get diabetic retinopathy. However, they are at risk for developing diabetic retinopathy in the future. And this is where prevention comes in. If there's one thing we want you to take away from our presentation today, it's that prevention is key. Prevention starts from educating yourself about the disease, so diabetes and diabetic retinopathy, which you've started to do by watching this presentation already. By implementing the habits we mentioned here in our presentation, and again, also located in our website, and avoiding the risk factors, maintaining healthy blood sugar levels, you will be less likely to get diabetic retinopathy. We also want to mention here that diabetic retinopathy isn't the only diabetes complication out there. There are so many others that we can't even begin to talk about in this presentation, but everything is all connected. If you maintain your blood sugar levels at a healthy level and you manage your diabetes well, then you will be less likely to get other complications, including diabetic retinopathy. So remember, prevention is key. Next slide, please. So now that we're nearing the end of our presentation, we would love it if our viewers could go ahead and take our post survey where the QR code is linked here. We'll also be providing the link below this video. Again, this is also completely voluntary, but we would love it if you could fill out this post survey, especially if you filled out our pre-survey a few minutes ago. And again, all information will remain confidential and will be deleted by the end of August 2021. And we'll be taking the data from the pre and post surveys to determine if our presentation was effective in educating you and other members of our community about diabetic retinopathy. Next. All right, so you can go ahead and pause here and just play when you finish taking the survey. All right, next slide, please.
All right, so here is our brochure, and this is basically a clear overview on what we covered about diabetic retinopathy. Please feel free to share with your friends and family to keep them informed. Here we have the QR code so you can scan it. Next slide, please.
And also, if you want to continue staying connected with us, we have our website, which is what you should be watching this presentation on. You can go ahead and look through that and read all the information. Instagram, we post as much as we can to give you more tips on how to prevent diabetic retinopathy. And we also have an email that you can also contact us from. Next slide, please.
We also have a podcast that we released, and it's where our team, which you can see on the Zoom, all of us are featured in the podcast where we talk about some of the cool research we found about diabetic retinopathy throughout our researching the subject, and also our personal experiences with UCR School of Medicine's Future Physician Leaders Program. So definitely check it out. It's linked in our website. We hope you'll enjoy it. So next slide, please.
And finally, thanks everybody for attending. We hope you had a great time watching this video, and it would mean a lot if you could fill out our surveys. Thank you so much.
Feel free to contact us through our emails if you have any question, comments, or suggestion. Have a wonderful rest of your day.